Well, we talk about all the violence that's happening in our city, but now there's a new study about how it's affecting our kids. This study was conducted in Philadelphia by Penn Medicine and the Children's Hospital of Philadelphia, and it finds that kids who live close to the violence are more likely to visit the emergency room later for mental health issues. And as of this morning, there are 391 total homicides in Philadelphia so far this year. So two of those homicides happened overnight. This one in South Philadelphia. A man is dead after being shot multiple times in the face, neck, chest, and body. And a woman was also hit by a stray bullet, and she survived. And in Kensington, a 28-year-old man is dead after police found him stabbed multiple times in his chest, neck, and torso. And of course, these incidents coming just after a drive-by shooting that killed a 26-year-old man and injured so many others near a busy SEPTA station in Fern Rock. So we want to bring in Dr. Aditi Vasan, a health services researcher at the Children's Hospital of Philadelphia, to tell us more about the findings of this new study about how this is affecting our kids. So Dr. Vasan, thank you so much for joining us this morning.
Thank you for having me.
I want to start with, because of course, I want to start with the fact that we're saying this is for kids who live close to the violence. Just how close are we talking to some of these shootings that you guys did for the study?
Yeah, so our study looked at the locations where shootings happen in Philadelphia, and then we looked at emergency room visits for children living within 4 to 6 blocks. So that's about a quarter of a mile from where the shootings happened.
Okay, a quarter of a mile. So it's not very far at all. And when these shootings happen, what are you seeing when it comes to the effect that it has on kids? And what age groups are we talking?
Yeah, so we looked at kids of all ages, really from kids as young as 1 or 2 to kids age 19. Most of the mental health related visits were in our older groups, so our kids who are school age or teenagers and up. And we found that kids living within, like I said, a quarter mile of a shooting were more likely to visit the ER for mental health related symptoms in the weeks and months immediately after the shooting. And this effect was greatest for the kids who lived closest in the 2 weeks right after the shooting, and for kids who are exposed to multiple shootings.
Okay, so it's a couple weeks after, up to months after. And when they are being taken in, what kind of issues are the children dealing with?
Yeah, I think it's a wide range of issues. Some of the things that we looked at in this study were symptoms of anxiety, depression, PTSD symptoms like difficulty sleeping, or an increased level of sort of anxiety or agitation about everything. And we know that trauma can present in a wide range of ways. So we looked at specifically mental health symptoms, but we might not even have captured all of the trauma-related symptoms with that.
And we're not even talking about, because at this point we've had so many shooting incidents, people who've been directly affected, like, for example, having a friend or family member that they've lost or been injured to some of the gun violence. You're just saying if you're in the area, like, for example, if you hear the shootings or you hear about them.
Yeah, that's exactly right. So with our study, we didn't look at whether these children knew anyone who was involved with the shooting or whether they were personally affected. But we really found that even if you don't know someone who was shot, really just living in the neighborhood where a shooting happens and seeing the shooting, hearing about the shooting can really affect children's mental health.
And like you mentioned, I guess it's the fact that it's the trauma of it all, because it's so unfair that kids have to be exposed to things like this at such an early age.
That's exactly right. And as a pediatrician, I've seen a lot of kids come in with these kinds of symptoms and say that they started after a classmate or a friend or a neighbor or just someone in their area was shot. And as you said, it's really the trauma of knowing that something like this happens in your neighborhood that can affect children's mental health.
So as a pediatrician, when you have these children come into you, what do you tell them? What do you say? I mean, it seems like it's hard to find the words that this is the situation that they're living in.
It certainly is hard to find the words. I think it's important just to normalize this and say, we recognize that this is something that's happening to a lot of children, and whichever way you're responding to it, that's okay. Some kids might respond by being more anxious or by acting out. Other kids might respond by being more withdrawn and not wanting to engage with people. And so we try to really normalize whatever emotional response they're having and let them know that there are mental health resources out there that can help, and we can help connect them.
And I hear what you're saying, but it's so hard, I'm sure, and many parents who are watching this probably thinking, normalize this? I mean, this shouldn't be normal.
No, not at all. And that's not to say that we should normalize gun violence happening or gun violence affecting children, because certainly this should not be the norm, right? And the numbers that we're seeing, particularly in the past couple of years, are so far from what should be normal for our kids in Philadelphia. But I think what we're saying is for kids who are reacting to it, normalize whatever their response is and say, we know that these events affect you, even if it isn't your friend or neighbor or someone who you know who was shot. So whichever way you're responding to it emotionally, that's okay, and we're here to support you.
Gotcha. So it's like, we know this is happening, we have to accept it, and however you are, accepting it or dealing with it, we want to make sure that they feel comfortable expressing that. Well, thank you so much, Dr. Vasan, and this is important work, and it's just showing another reason, another layer for why we have to get a handle on this gun violence, because it's affecting our future. Thank you so much.